very much again for giving Ethiopia this opportunity. And of course, in this presentation, I'm trying to give you, already Kim has given you some picture of the epilepsy service and what epilepsy is about in the rural area within Ethiopia. And I also, just building on that, want to give you the general picture of epilepsy and the work CareEpilepsy does in Ethiopia. So basically, CareEpilepsy is about changing the face of epilepsy in Ethiopia by creating more awareness, and we believe it's more awareness that brings more acceptance. Now, I look at epilepsy, and I kind of feel epilepsy is like an octopus, with so many branches, because epilepsy doesn't just affect you physically, but it affects mentally, it affects socially, it affects economically. There isn't a part of life that's not affected with epilepsy. So that makes our intervention even more harder, because you have a lot of areas to fill in. So when we look at the prevalence and treatment gap of epilepsy in Ethiopia, about 1.5 million people are expected to have epilepsy, and this is very much understatement or underestimate of the burden of epilepsy, as there has never been a countrywide research done on epilepsy or prevalence research. But out of the 1.5 million, only 1.3%, that's 1.3%, have access to medical care and treatment in the regions. And the regions include about 80% of the total population of Ethiopia. And then in Addis Ababa, it's only 13% of people who have access to care and treatment. And this brings the treatment gap, it's almost like 95%. So one of the challenges that we face there is the cost and availability of anti-epileptic drug. As it is the same, within other African countries, the widely available anti-epileptic medication is phenobarbital. And as you can see, the price is lower compared to the others. It's really phenytoin, tegretol, and lamotrigine and sodium valproate that is really available, the choice of medication, but mainly phenobarb. But if you look at the price range, the majority of people cannot afford taking anything but phenobarbital. And then when you look at access to diagnostics, we know that MRI and EEG doesn't identify, epilepsy, but it assists in the diagnosis of epilepsy. So we can learn about why the seizure is there, why the epilepsy is there. So the real pictures for the Ethiopian community with people with epilepsy, they have no access, the majority of them, to EEG and MRI and CT scan. It's just a luxury. So basically, you are diagnosed with epilepsy, you come in, you bring someone else with you. Have you noticed that person having, a seizure? Yes, 2 times and more than 2 times, and then you have epilepsy. So as I said at the beginning, the burden of epilepsy is wide, the effect is wide. And when we look at on the individual, a lot of people are facing displacement and forced to leave their community because they have seizures, and because seizures are in most cases that not considered to be involved with mental illness or satanic or evil spirit. This beautiful child I found when I was traveling in the southern area of Ethiopia, who was displaced with the mother because the child developed seizure, epilepsy. So basically, they were just chucked out of their, from their community. And these are children with epilepsy that I found in a Catholic Church mission in Jimma. And all these children, it is really such a sad story, because when I went in there and I'm talking to and I'm asking about the children, and every one of them, the name they were given is like Teresa. So like after Mother Teresa. So I asked, what about their name? And nobody knew their name. The families just dropped them off at the door of the mission compound. Some of them with a note saying, she's evil, she's got evil spirit, he's got evil spirit, and we can't deal or help that person. So we've got children there with no family history to trace, and this is the face of epilepsy. Sorry, can you please switch off the mic? All right, thank you. Another experience of epilepsy that we see more often in our work is the physical injuries of epilepsy resulting from the uncontrolled and unpredictability of seizures. And these are 3 ladies who unfortunately have experienced severe burn injuries due to seizures when they were cooking in the open fire. So again, epilepsy means this is it. This is the face. Now, epilepsy also has psychological costs to the person and the family living with epilepsy. And that is patients being hidden by their families and choosing not to reveal their conditions. So children grow old without being connected, like having social connection with family members or any social gatherings, just to hide them from the community so they're not seen having seizures. Young women with epilepsy are even more vulnerable, increasingly subjected to physical and sexual abuse. Exclusion from social life and relationship is just the norm. Exclusion from schools for children, that is the norm. Exclusion from employment, that is the norm again. And this results in having poor self-esteem and other mental conditions such as anxiety and depression and schizophrenia, being developed by the individual, the person with epilepsy, but also the parents, the family. Now, sorry, I missed that one. When we look at the impact of epilepsy in the lives of children, it is even more severe than the adults, because the exclusion from social interaction and bullying results in behavioral and health problems. So we see pretty much most of the children with epilepsy going through and suffering from behavioral disorder. The incidence of epilepsy appears to be highest in childhood, with an incidence of 187 per 100,000 per year between the age of 6 to 12. And there's no support system for single working mothers who are forced to lock their children at home while going out to work, endangering the child's life. This is a very normal circumstances that we face. In most cases, the husband leaves the family because the child has epilepsy, and it's, more often considered or seen as it's the woman's fault. So basically, there is no social support. So the mother has to go out and work, and that means locking the child in the house. And then if you look at clinical care, there are only 2 pediatric neurologists in the country. All in all, we have 30 neurologists in Ethiopia, no epilepsy specialist. Out of the 30 neurologists, 28 of them live in Addis Ababa, and only 2 of them live in the region or work in the regions where 80% of the people live. So it really it shows you how much there is kind of, imbalance between care or the non-existence of epilepsy care. So now we can talk about CareEpilepsy Ethiopia. So who are we? Oops. So CareEpilepsy Ethiopia is a non-profit organization that aims to achieve a better quality of life for people affected in epilepsy in Ethiopia and in Africa in general. So it has a Pan-African sentiment. So secondly, we're not a medical service provider, but facilitate the establishment of service to boost epilepsy care coverage and providing training to build capabilities. So we give voice to children, young people, women, men living with epilepsy and their families. And finally, we are an instrument for dialogue with within the national and regional and international organizations to improve the factors or the challenges, to address the challenges that affects or contributes to epilepsy in Ethiopia. So CareEpilepsy started with my own personal experience. I live with epilepsy. I was diagnosed with epilepsy when I was at the age of 17, and luckily I came to the United Kingdom at the time. So I am one of the lucky ones that I get treatment from a neurologist who's, epilepsy specialist neurologist. But again, you go through the challenges of living with epilepsy. Even if you're on medication and you live with it for quite a number of years, it's still a challenge. As you can see from my face, I had another seizure a couple of weeks ago. So, with the bruise, and luckily, I'm not dead, or I'm not seriously physically injured. But what I'm trying to show you is living with epilepsy is a daily challenge that you face. But at least because the service is here, the medications are here, and the supports are here, you can achieve what you want in your life as with a person living with epilepsy. I've done my master's in public health, and I've worked within the National Health Service and reasonably successful life. But when I look at my brothers and sisters in Ethiopia and in the continent of Africa in general, that opportunity is not there. And I've established CareEpilepsy Ethiopia to be an instrument to start this service in Africa. So our vision at CareEpilepsy is to see people with epilepsy protected, respected, healthy, enjoy life, free from discrimination and stigma, and achieve the best mental wellness. Our mission is saving lives by improving the health and mental wellness of individuals with epilepsy and their families, and changing perceptions about epilepsy through education. Now, when we talk about epilepsy, we're not treating, again, going back to the first slide, it's an octopus kind of effect, because you're not just treating the individual, because the stigma and the exclusion affects the families of people with epilepsy. So our mission and intervention also includes the family. And of course, we value, our values, equitable and timely access to medical care, and respect and dignity for people with epilepsy. And one thing that we very much take it to be a very serious part of our intervention is involving local leaders, because they are part of and the best agent of change. And of course, we can't do our work without partnership. This is CareEpilepsy Ethiopia when we first started in March. As you can see, we had a very tiny little office. We got one chair. Actually, no, I didn't even have a chair. I had, you can see the mattress on the floor, and that was where we were sitting. And I had one chair, and a person came to visit us and felt sorry for us and donated this one chair and that desk. And that is how CareEpilepsy was started. This was our tea and coffee. So what is our objective? So CareEpilepsy's objectives are really embedded in four major objectives, and that is to improve access to epilepsy care and anti-epileptic drugs. So it doesn't matter how much awareness you do, how much education you do, if the patients don't have access to medical care and anti-epileptic drugs, it's meaningless. It's like telling the people that are going through starvation, telling them the importance of food without giving them food. So this is our first and most important objective, and we provide this by providing monthly free clinic. So we've got doctors who come and volunteer at the clinic and who see patients, and we provide medication and EEG diagnostics. So that's supporting the patients. So another thing is we want to establish telemedicine, and I'll talk more about it at the end, and also to improve the clinical capacity of the nurses. Our focus is on the nurses, and we give training and e-learning modules. So if you look at here, it's the doctors giving teaching, training, all the ones that are sitting behind our nurses attending, yes, about epilepsy. Again, this is following the same thing, another training. So if we look at our objective 2, and that is our public education and awareness. And that is our awareness is promoting epilepsy and understanding of epilepsy for patients and the community. Okay, so we have programs that are targeted for the patients and for the community. We make use of the media, the TV, radio, and of course, social media, our website, Twitter, Facebook, and Instagram page. We put a lot of information there so people increase their knowledge about epilepsy. And also we raise awareness working with other professionals, and that is doing collaborative regional conferences with different health hospitals or healthcare providers in the regions. And also we provide multidisciplinary workshop. And then we do campaigns such as a National Epilepsy Week, which we've started in 2016. And we also give epilepsy training for patients and family. And we teach at health centers, hospitals, schools, organizations, communities, and social group, and in faith communities. This is just some of the pictures that we do when we're teaching schools. And so far, we've managed to reach out and educate 127 schools. And so when we teach at schools, we also give special training for the teachers, but also the people as well. And this is our first National Epilepsy Week campaign. As you can see, we do a walk. It's a 1-week campaign. We use the media, and the closing ceremony is always a walk in the city, and we've done 6 so far. And another thing we do is actually teaching seizure recovery position in a form of drama, so it's easier for people to understand. And this is one of our National Epilepsy Week campaign in the regions, in the southern region. And this is where we give clinical training for nurses and health extension workers. And this is another one. So our third objective is to, sorry, I went too fast. Is to impact the wellness of people with epilepsy. So what we're trying to do is increase social connectedness. Because of the stigma and exclusion, a lot of people living with epilepsy feel very lonely and vulnerable. So in order to increase that social connectedness, we have set up a patient support group, which meets monthly. And we have a coffee morning program, which meets weekly. And also we provide telephone helpline. and we provide counseling, face-to-face counseling, and also telephone counseling. And we've also set up an income-generating activity to develop sustainable skills, like a project called CareCraft. And this is a picture of patient support group meeting, one of our meetings. And of those who attended support groups, this is in 2020, 100% of them felt they were able to cope better with their condition and reported improved sense of belongingness and connectedness, and which is a great privilege for us to be able to do this. And this is another craft work, rug making rugs that we've given to patients to just help them to be economically able to take care of themselves and buy their medication. And these are the different drugs that were made. And our last objective is advocacy. So that is, again, another big part of our work. And that is partnership. Our advocacy is partnership with key partners, like, for example, those and stakeholders, those that work on maternal care, religious leaders, and also engaging volunteers, especially the youth, in raising awareness, and also involving the community, and the patients. So we set up a patient representative committee. Again, they meet monthly and they plan and check our programs and what is going on and what they think will be needed for the patients, or what the patients need, rather. And of course, the other part that we haven't done yet and we want to do is to have access to international research database and to do audits and surveillance, and of course having to have a countrywide research to know countrywide prevalence of epilepsy. So these are our youth volunteers that work with us in raising awareness, and we encourage them to become a volunteer and to make a difference. So to wrap it up, our achievements so far is we've registered as the only epilepsy charity in Ethiopia, and we've improved epilepsy service by providing clinic and facilitate referrals. So we work more on referrals because as one tiny NGO, you can't serve 1.5 million people. So we're trying to make the government to have ownership of the program and to really, push them to improve the service. So we facilitate the referrals for them to be seen by government hospitals. And again, increase access to anti-epileptic drugs. This is so what we can supply, we do that, but also this is a daily argument with the Ministry of Health to be able to, to consider anti-epileptic medication as a priority to provide for, to order and provide for patients. Engaged in doing education advocacy work to reduce the stigma of epilepsy and increase the capacity of nurses who treat epilepsy by giving clinical training about basic epilepsy management. Again, the patient support group, the psychological support for patients and family through counseling service, and the telephone helpline, and the income generating activity, and creating awareness, and the National Epilepsy Week to facilitate well-being experience of our patients. So our priority service for 2021 is again to build on the clinical care and medication, and to continue to raise awareness and training and telemedicine, especially the telemedicine. We desperately want to start that, and I am actually looking forward to discuss more with this group to see how you can support us to do this and continue to provide the workshop and the diagnostic service. We've been lucky that we've received in donation an EEG machine. So we want to purchase another one and establish the service and the research. And for 2021, this is pretty much the cost for our charity, which we haven't achieved yet, but we work on that one. So, in conclusion, our fingerprints don't fade from the lives that we touch. That's what I believe in. And I want to invite you to be the change in Africa. Thank you.